guys, welcome to my channel. It is Little Susie Sleever. I am out driving around while I'm leaving my house right now. I have quite a bit of updating for you guys. You know, my last video I kind of gave you some information that turned out to not be true, so I have some corrections to make. So let's start with our numbers. So my high weight, which was also my surgical weight, was 251.8 pounds. My current weight as of my last weigh-in, which was this past week, I have another weigh-in coming up, was 186.8 pounds for a total loss of 65 pounds even. Now, that was my official weight loss, my official weigh-in. I have gotten on the scale since one time and had a weight of 186.4 pounds, which is a total weight loss of 65.4 pounds. But that's not my official weigh-in because it wasn't on my official weigh-in day, so we're not going to go with that. I just feel like telling you guys because it makes me feel good. So there you have it. Beyond that, let's talk clothing sizes and such. When I started out, I was wearing a size 20 in pants, and they probably were not the appropriate size. They definitely were not the appropriate size. We'll go with that. They were, without a doubt, with zero question in my mind, they were not the right size. Because I looked like a busted can of biscuits in those. So, yeah, they didn't fit me right. And that's fine. I probably was more so like a size 22. And I'm short. I'm around 5'2". So that's really, yeah, that's not good. So now, and I was also wearing a 2X in scrubs. In most scrubs, it varied between a 1X and a 2X in scrubs. So currently I wear a size 14 pants. Depending upon the brand, I could do a size 12, but the problem that I have with a size 12 is that my flubby, loose, gross skin post weight loss surgery kind of just floops over it and gives me a giant case of muffin top, which is not a good look for anyone. So there's that. Scrubs, I wear a size large. Some brands I might be able to get away with a medium, but I don't think I'm quite there yet. In shirts and things that are sized by letters, it's a medium. I find that my biggest problem area is my midsection from like under my boobs down to my thighs. Or, you know, my gut, my lower tummy, my upper tummy. I have a lot of mushy, flubby grossness. That seems to be where I'm holding on to weight a little bit more. It is what it is. So in my last video, the untruth that I told you unintentionally was that I had a doctor's appointment that was coming up, and I was going to do a video after that. I did not go to that doctor's appointment. My husband ended up having a dirt bike accident and broke his leg, and he had to have surgery. So I ended up having to cancel my surgeon's appointment so that I could take off to go to his ortho appointments, and then also his take off so that I could be there whenever he had surgery, because I had to be. So, you know, being a responsible adult, I can only take off so many things, so many days, and these are the ones that kind of trumped out because it was an emergency. So I've got to reschedule it still. I'm hoping to reschedule it towards the end of next month, the end of March. And if I can do that, then I'll be happy-go-lucky, honestly. But it's hard to get in, and I have to get the last appointment of the day because of my work schedule. and because it takes forever for the surgeons to get you in to see you. So I kind of have to be conscious of that. So it may not be next month, it may be the following. It is what it is. I just have to push through it. I mean, there's nothing I can do about it. If they're unhappy about it, so be it. I don't think they'll really have an issue with it. I'm sure they understand. And given that it's being done through an Army hospital, they can verify that he had surgery. It's really simple. He had surgery there. So that's kind of where I stand with everything right now. So I didn't have that appointment. I didn't get to do my official weigh-in or see how I'm doing. I did pick up my lab work when I was there with my husband having surgery this past week. So I picked up my 6-month lab work. I am vitamin D insufficient. I am not deficient, I am insufficient. So when you're vitamin D deficient, that's when you have to really kind of worry about things. Insufficient, it just means that I really need to be more conscientious about taking my supplements, which I don't do. I'm terrible when it comes to taking my vitamins and supplements. So I have to be more conscious of that and put forth a better effort to get the vitamin D supplements in. Vitamin D insufficiency can cause like joint pain, bone pain, and I've had a lot of that. So this would be a good way to fix that. So I'm gonna really try to work on being more proactive about taking my supplements and my vitamins because I need to. But I'm a terrible patient, and I believe that that is the case with many nurses. Many nurses are terrible patients. We're just non-compliant people. We don't have time for stuff. I mean, we should be the best patients ever, and we're not. So it is what it is. You know, you just do what you gotta do. So beyond that, let's see. The hair loss has completely stopped. I mean, I lose a strand here and there, but that's normal. That is normal hair loss. I have, I would say, roughly 1 inch to 1.25 inches, maybe 1.5 inches of new growth. That is compliments of all of the biotin that I take when I take it, because I'm pretty non-compliant about that too. I just suck as an individual. Let's put it that way. So there is that. It is definitely doing its job with regards to hair growth. So I really noticed it around my temples and, you know, just my hairline, because you can, and my part, because you can really see the new growth there. And that's kind of where I've noticed it recently. Now, I have also noticed that my hair looks and feels much fuller when it's clean. Right now, it is dirty as a mug. It is not clean. Today is like scramble around, try to get all your stuff done. Dry shampoo the shit out of your hair day. So I have a couple of college papers that are due. Well, I turned one in Friday while my husband was having surgery. I did that. Thank God for being able to have a hotspot on your phone to connect to your laptop with, because that's what I did while he was in surgery and recovery. Is I worked on homework and was able to get one of my assignments done for the week. I have one that's due tonight as well. So I've got that, and then I'm extremely busy with the broken husband and school and work. The hospital is, when I left Friday, we were still at max capacity. We had no room, we had no beds on my floor, no beds in a few of the other floors. The only places that we had any beds available were the hemonc floor, which is hematology oncology floor, so the cancer floor, and PICU. We had a couple of beds in PICU, but we had patients that had overflow from, you know what I just realized? I've been driving around town without a damn seatbelt on. I am a bad person. I've never done that before. I was clearly in a hurry to get out of my house where my broken husband is driving me crazy. I love him, but it drives me insane when he is known for the count. I should be good with this because I'm a nurse, but when it's in your own house, there are only so many days that you can do it before you lose your mind. And that's where we're at right now. Which is pretty awful to have to say. But that's, you know, it is what it is. So beyond that, yeah, I'm super busy at work, super busy with school, super busy with the broken husband. I just can't seem to get a lot done. On a positive note with my husband being broken, the one upside to a broken husband is that I am left with a husband who cannot use his gym membership, which they were so gracious as to allow me to switch over to my name and use while he is broken. I say gracious, really their other alternative was they would have suspended his account, and then it would have just picked back up whenever he was able to work out again, or they would have waived his fees for, you know, 4 or 5 months, because it's going to be a while before he is able to actually work out. So he'll have 6 to 8 weeks of being completely non-weight bearing, and then he'll start physical therapy, and so we're looking at 3 to 4 months before he can ever even use it. It's pretty crappy, but it is what it is, you know. Outside of that, you know, I feel compelled to say something. So I follow another YouTuber. I follow a lot of YouTubers, and I follow another one in particular, and I believe she follows me as well recently. I don't know if she actually has watched any of my videos or not, but I'm on her Facebook her Facebook and her Instagram and stuff, and I really enjoy her videos, and I enjoy her posts, and I enjoy watching her transformation, and she seems like just an all-around really awesome person. She's also a nurse. She's fucking awesome. But there was a post that she made that was a little bit controversial. She has since made a video about it as well, discussing, you know, just the controversy that it kind of caused. And so I wanted to touch on the issue myself, because while I really enjoy this other YouTuber's videos and all of that, I do have a differing opinion to some degree on this particular topic, and it's, you know, I respectfully disagree with her, because like I said, I really enjoy her channel. I believe she's super smart, and everyone has a different opinion, everyone has a different view and a different belief on things. This one I just happen to feel differently to some degree. There are certain parts of this topic that I do agree with her on. So that being said, the issue was whether or not it is acceptable to lie about having had weight loss surgery. And I'll try to put her perspective, or sorry, I don't even know what I'm saying right now. I'll try to kind of give you guys a brief synopsis of her viewpoint to the best of my ability without, you know, misconstruing anything. So her view was that it is, you know, if you don't want to tell people, that's fine. She's an open book. Everyone knows about her surgery. But if you don't want to tell people, that's fine. But she does not like when people lie about the method that they used to lose weight. And that's where we have a little bit of a differing of opinion. So personally, myself, I don't care what any one person does. I don't. If you want to be an open book about your surgery, be an open book. If you don't feel like your support system is open to you being completely truthful and forthcoming about it, don't. Do I believe that it is the best practice to lie about how you lose weight, the methods that you use to lose weight? No. But I also know, in my opinion, that as an overweight person, there were a lot of things that I did out of self-preservance, or to protect myself emotionally. For example, I didn't tell people my weight ever. I did not tell people my weight until I started losing weight and started telling people then. My own husband did not know how much I weighed until I was under 200 pounds. I had lost over 50 pounds before I ever told my husband how much I weighed. So, and it comes from a place of embarrassment. It comes from a place of self-loathing. It comes from all of these things. And personally, having had someone told that I had surgery without my permission, and it was my husband's honest mistake. It was his best friend. He didn't think anything of it. He, thought, well, I know that she doesn't want everyone knowing, but Damon's not everybody. Damon's his best friend, so he told Damon, and Damon's response was, well, desperate times call for desperate measures. And that was really painful to hear. It wasn't supportive, and you know what? Damon is a true to form masshole. And by that I mean he's an asshole from Massachusetts. I love the guy. I will give credit where credit is due. He's not a cuddly kind of guy. But when my husband deploys, 9 times out of 10, he is the first person to call and check on me and the kids. He's deep down a good person. He just maybe doesn't word things quite the way that he would like to sometimes, and he comes across as an asshole. And I'm sure he would straight out tell you that he's an asshole. It is what it is. He's an asshole. Good-hearted asshole, but an asshole. And so that comment really resonated with me, and I, at that moment, I knew I'm not going to tell anyone outside of the people that I'm very, very close to. I'm not going to tell anyone about my surgery, because I don't want this response, and this is coming from someone who knows me well, or pretty well, someone who, cares about my well-being to some degree. What kind of a response could I get from the people who don't, from, quote, the haters and whatnot? So I've opted not to tell anyone. Now, if they find out that I had surgery, yeah, if they ask me, did you have surgery? Am I going to lie and say, no, I did not? Absolutely not. If someone comes at me and says, hey, did you have weight loss surgery? Yes, I did. But if someone comes at me and says, so what are you doing to lose weight? It depends upon who it is. Now, I have a friend that recently posted in a very close-knit group of people that we have that she was looking at having weight loss surgery. And she wanted to know if anyone else had lap band, is what she was considering initially. And I believe it's still kind of something she's going back and forth with. And I reached out to her. I sent her a private message and I said, hey, you know what? So-and-so, I did. She's like, what? You did? When did this happen? I said, well, it happened about 6 months ago, and I didn't tell anybody because I don't feel comfortable, but now you know. I'd prefer if you'd keep it between us. There's a few other people who know, and I kind of gave her, one mutual friend that we have that knew. I said, she knows, but outside of that, none of our other mutual friends know, so I'd prefer to keep it that way, but this is what I'm doing. And she, no problem there. So if it's someone who is looking to learn about the surgery, yes, I will divulge that all day long. If it is someone who asks me straight out, did you have surgery? Yes, I did. I'm not going to bold-face lie to you. However, I will skirt the truth. I will be elusive with the truth. And I will not openly divulge what I chose to do with regards to my healthcare status, my surgical procedures, things like that, to the rest of the world. I don't believe that the other YouTuber was wrong. I don't. I think that her opinion is, and her view is certainly valid. And her ultimate view was, if it's not the whole truth, then it's a lie. And I can get on board with that. I can understand where someone's coming from with that. Myself, a partial truth, I don't believe that that is a bold-faced lie. Is it the entire truth? Is it the whole truth? No, it's not. But I don't believe that we tell the entire truth to anyone and everyone on a regular basis. And I don't believe it's anyone's business if I've had surgery. But I just want you guys to know that, you know, there are differing opinions out there. And no one's opinion is wrong. And you shouldn't be made to feel like your opinion is wrong. And I'm not saying that the other YouTuber did that, because she certainly didn't. She did it in a very respectful manner. Like I said, she seems like a genuinely all-around really fucking awesome person. In fact, you guys should check her out. Her name is Lauren, and I believe her YouTube channel is Lauren Losing. She has a lot of followers. She's really, really awesome. She's 2.5 years out post-op. She's looking at having plastic surgery in a few months. And she's a wealth of information. She is genuinely awesome. You should definitely check out her channel. But I just wanted people to know that there are differing opinions out there, and that no one opinion is right. It is an opinion for a reason. Her opinion isn't right. Her opinion isn't wrong. My opinion isn't right. My opinion isn't wrong. They're just different. We do not share the same opinion on this one issue. It doesn't make any one side or the other correct or incorrect. What I will say, and this did not come from her, but what I have seen it in forums and I've seen it in groups, there's a lot of times very, very strong opposition to your view on this issue. So if you don't feel like you should tell everyone, and you are not going to be entirely truthful about it, you will, if you mention that in certain forums, you will receive backlash. So please be conscious of that. At the same time, if you are very anti not divulging the entire truth and being an open book, so if you are like, you know what, you have to tell the truth, the whole truth, be an open book, be an advocate for these people, that's great. If you can do that and you're a strong enough person to do that, go for it. But you will get backlash from the other side of the fence who's like, I don't have to tell people about my healthcare status. I don't have to tell people about my medical history. That's my private information. You will receive backlash from it. And like I said, the backlash didn't come from this YouTuber. And I didn't receive any backlash, but I did see her receive some backlash. I gave a differing opinion on the subject. It's just something that people don't agree on. So you have to be kind of conscious of that. You're going to get, you know, it's like any community, there are things that people don't agree upon. On that note, I am going into Ulta to spend some money. So I am going to go ahead and call this video quits. It's like 23 freaking minutes long. So I apologize for that. Thank you guys for tuning in. If you enjoyed the video, please give it a thumbs up. If you'd like to see more, click the subscribe button. I would love to have more subscribers. If you have any questions, any comments, anything you'd like to discuss, please, please, please feel free to ask away in the comment section, or you can send me an email. It's the same as my YouTube address, but at gmail.com. And I'm more than happy to chat about anything. If you have video ideas, please give me feedback. I would love to do maybe a 6-month Q&A kind of thing, but I don't know that I have enough followers for that. So if you guys have some questions, throw them at me, and I would love to maybe incorporate that into a video, maybe a short video, because I don't have many followers. I don't get many views at this point. So, you know, I'll do what I can. Also, if you know of anyone who's having surgery and has questions, please direct them towards my channel. Maybe I can help them out in some way. Love you guys, and I will check in with you as soon as I possibly can. Bye.